Okay, so it's officially noon. Good afternoon, everyone, and thank you for joining us today. Our media briefing today will provide an update of COVID transmission in the region, and we will be providing an update on the recently announced expansion of booster dose eligibility. So joining us today is Dr. Thomas Pigott, who will be providing an update and will be available for questions at the end of the presentation. So to get us started, a few housekeeping items. Please remember to stay on mute with your cameras off during the presentation. There will be a Q&A at the end where media guests can ask their questions. Please identify yourself by raising your hand if you have a question, and I will call on you in whichever order it pops up. The session is being recorded, so it will be on our YouTube channel after the presentation. And thank you for joining us. We'll get started. So as a settler ally, I want to acknowledge the land that we have the privilege of living on. Today, specifically, is a beautiful day outside. So we respectfully acknowledge that we are convening today on the Treaty 20 Mississauga territory and then in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations. So those include Kirk Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. We respectfully acknowledge that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So I am going to move on to Dr. Pigott's presentation, and you can take it away.
Thank you so much, Sarah, and thank you everyone for being here today. We wanted to, as we're entering into this seventh wave, provide an update on the COVID context and situation, but also make some time to answer questions and provide a bit of the nuance that's really needed around this fourth dose availability now, especially for 18 to 59-year-olds who are healthy. So I'm going to take some time, maybe longer than I usually would, to explain this because it's not something that is as black and white and easy to explain as perhaps other parts of the pandemic response to date have been. And I also, of course, want to take this time to remind us of all of the tools to protect against COVID-19. So next slide, Sarah. What I'm going to do first is just review our current risk index. So you can see here we are at moderate, and that's driven by increasing case counts, PCR and rapid antigen percent positivities that are on the higher side. We have not, and then we'll go into the wastewater surveillance onto our next charts here, Sarah, seen a dramatic increase in the Peterborough public health region yet in our wastewater. We had a small bump over the last couple of weeks that's plateaued, but we are, and I'll come back to the provincial context, anticipating that this will increase in the coming weeks. So going through, this is showing Peterborough, Lakefield, Millbrook, and Norwood, and Havelock. And you can review these on our risk index dashboard if you're interested in having a more detailed look. But if we go on to the next slide and look at the provincial context, we fit into this central east region, and you can see quite the increase that's coming. And increases in parts of the province, that are signaling a start to a summer 7th BA5 driven wave. We know with previous waves of this pandemic, our region has often lagged behind by a week or two before we start to see these increases. And again, I'm anticipating that that is what we will likely see here in the Peterborough Public Health region as well. So on to our next slide, we're going to talk about what has changed and what hasn't changed. So to begin, what hasn't changed is that for everyone, eligibility and getting your COVID-19 vaccines, including the first, second, and third dose for everyone 12 years and older, is very important. This is a vaccine that really requires those as part of the primary series. And we've learned that in the past year, as more evidence has emerged, that that third dose which you know, often called a booster, is actually pretty critical to protection. And you get a large amount of added protection against severe disease, infection, prevention of problems like long COVID from that third dose. Unfortunately, our coverage for third doses is not what we would like it to be. It's much lower than that. And we are hoping that more people will come forward and receive their COVID-19 vaccine. Because to date, we still only have 54% of the population covered with 3 doses, while we have 81% covered with 2 doses. So that gap of almost 30% is something that we hope to close. And it's all part of the conversation and communication we're trying to put out about staying up to date with COVID-19 vaccines. Because this pandemic continues, we're anticipating that need for, top ups to your immune system will continue into the future. But we have an important proportion of the population, almost a third, who are now lagging behind and don't have that full protection. So the most important reminder as we talk about who's eligible, I want to start with is reminding you that the third dose is really critical protection if you haven't had it so far. Moving into the conversation around fourth doses, we know that for those who have already been eligible, and what changed yesterday is the 18 to 59-year-olds, but those already eligible included those 60 plus First Nations, Inuit, Métis adults, and individuals who are immunocompromised. But for those groups that even before yesterday have been eligible for a fourth dose for some time, that is important protection, and the benefit is quite significant. For 18 to 59-year-olds, I'm going to spend some more time today and we'll come back to why this is more of a discretionary or conditional recommendation. For other populations, 60 plus, those with medical risk factors, this is a strong recommendation to get a fourth dose. So we're going to move along to remind you what the immunocompromised recommendations are, and both of these tables are available on our website if you're interested in reviewing further or linking to them. We would greatly appreciate that. So for immunocompromised individuals, we know that it does require one more dose to essentially have a similar level of protection. So the fourth dose is often considered the first booster, and the fifth dose now considered a second booster for that population. And you can see by age the eligibility and recommendations. On to our next slide, Sarah. This is just to reiterate the point that third doses are strongly recommended for everyone 12 plus who are eligible. So if you haven't received yours yet, it's critical protection in order to stay up to date with vaccination. When we talk about the fourth dose, I want to re-emphasize for those 60 years and older or those with medical risk factors for severe COVID-19 who are younger than 60, it is strongly recommended and this added protection is important for you. But for healthy 18 to 59-year-olds who do not have medical risk factors, it's a little bit more nuanced. And this is something the Chief Medical Officer of Health articulated yesterday. And I'm going to go into more detail here today talking about the factors I think folks should be thinking about as they're making their own decision whether to get the fourth dose or not. And I'll be happy to answer any and all questions to provide further clarity as well. So on to the next slide, Sarah. You can see here an important caveat. Again, we're talking about 18 to 59-year-olds who are healthy. The other groups, this isn't the next few slides is not applicable to. But 18 to 59-year-olds who are healthy were made eligible for the fourth dose yesterday by the province to open that up. You know, we are going into a seventh wave. I can understand and appreciate the decision there. However, this is not a group that NACI, which we have taken recommendations for vaccines to date, and the province follows. This is not a group that NACI has recommended yet. NACI talked about in the fall, in the context of potential fall planning, a COVID-19 vaccine could be considered. But we're in a bit of a different context, and now with going into a seventh wave, that's important to put into the context as well. The challenge, which is articulated in italices as a quote from NACI up top, is that the evidence is limited, and as to now, the certainty of how long that protection will be is not entirely clear. This is the evidence around how beneficial it'll be for people, but the evidence around safety and harms hasn't changed. This vaccine continues to be well studied and a safe vaccine. So it's important as we contextualize this that we're not talking about whether it's safe or not to get. It's safe, very much so. If you want a fourth dose, it's safe to do. The question is how much benefit you will actually get at this point versus waiting for a fourth dose to another point into the future. If we go to our next slide, Sarah, you can see I'm going to go through a number of factors. We also have a 3 minute or so social media video that I try to articulate some of these that may be useful to folks in media and through sharing on social media. So first of all, like I mentioned, this vaccine is safe, and the rare adverse effects are limited and favor vaccination for most people. For those who are concerned about the risk of myocarditis or pericarditis, again, this is a very rare event. It occurs in approximately 1 in 7,500 people. That event, if people do develop myo or pericarditis, often they'll get chest pain. They may have to go see a healthcare provider or go to the hospital. But even those that do develop it often do very well, and the risks of severe disability or death are very, very low with that. So, again, it's rare to get, and it's rare to have significant complications if you do get it. The other two important caveats are that the risk of pericarditis and myocarditis are actually higher for people that get infected with the virus COVID-19 than who develop it after vaccination, which again is rare, and that the risks decrease. We know evidence from the third dose is that the risks are lower than for people with the first and second dose. So again, I want to emphasize this fourth dose is safe, but the question we're trying to talk through is the benefit of getting it now versus later. Transmission is increasing. So this is something to think about. We're going into a seventh wave here in the province, and so risk is increasing, and benefits may be more important. Exposure risk is an important individual consideration. Some people are frontline workers, healthcare workers, and they may be at higher risk of seeing people with COVID-19. Other people may be traveling in airplanes or being in poorly ventilated areas more often. And again, your risk of exposure to COVID-19, especially into the seventh wave, may be higher. Some people may be around those who are elderly, not yet vaccinated, immunocompromised, or medically at risk of severe COVID 19. And for those people, they may want added protection to protect those around them, even if that added protection is smaller. And then again, like we talked about, the risk for yourself is important. And on the next slide, you can see the risk of hospitalization, which is very low amongst those who are younger and increases to very high for those who are elderly, especially those who are 80 years and older. And the risk of death follows a similar pattern on the next slide, where again, it is those who are older overwhelmingly that are impacted by death due to COVID 19. In addition to hospitalizations and deaths, there still is uncertainty and risks of long COVID. Long COVID or post acute COVID syndrome, onto the next slide, Sarah, is a phenomena that many people are experiencing, as much as somewhere between 1 in 10 and 1 in 2 people who get COVID 19 infection may develop long COVID. It can carry debilitating effects across a bunch of parts of the body, and the science on this is still very much in progress and evolving. Um, the good news is we know that vaccination decreases the risk of long COVID. So again, the risk for young healthy adults of hospitalization and death is very low. Long COVID is a risk and concern, but even with 3 doses, the risk of long COVID does decrease. We don't yet know what the benefit of a fourth dose is to potentially preventing against long COVID symptoms. On to our next slide, Sarah. I have, I'm going to go on to a few more things that could be considered by healthy 18 to 59-year-olds. The first is if you've had a recent infection, the recommendation is to wait 3 months before the next dose. So if you've rapid antigen tested at home or you've had a PCR test because you've been eligible and you have a recent COVID-19 infection, it is probably better and your immune system will have a better, more robust response to the vaccine if you wait this time period. A key consideration that lots of people are asking is if I get a fourth dose now, how long will that add protection for me? And unfortunately, we don't have a lot of evidence on this, but the evidence that we do have, much of which comes from Israel, and I'd be happy to answer more questions if there's detailed interest in that. Much of that evidence says the benefits against prevention of infection with a fourth dose is probably only for 2 to 3 months' time. It's a short lived transient protection. We're working on and we're looking forward to next generation vaccines. We're expecting that some will have an additional strain of Omicron added in the fall. The name for that is a bivalent. Um, and and those vaccines may be a lot more beneficial. But for now, with these vaccines that we still have, the protection that it gives your body may be short lived and maybe less, certainly than previous doses of the vaccine. So part of the consideration for individuals is trade-off and protection. Do we want protection now or in the future? Generally, a longer gap between doses, which is why the 5 months minimum is recommended, gives a better immune protection overall. So that's an important part of the consideration. But at the same time, like I mentioned, we are headed into a seventh wave. The eligibility consideration is important, and yesterday the province indicated that getting a fourth dose now will not impact individuals' ability to be eligible for a next generation or bivalent type vaccine when it becomes available in the fall. And so, while you shouldn't be concerned about getting it now and not being eligible in the fall, the amount of protection that you get if you get the vaccine now may be different if the vaccine, next generation vaccines available in the early fall. Your immune system may not have as strong of a response to getting protection from the new vaccine. And finally, timing is uncertain. We have gotten indication that the vaccine manufacturers anticipate the bivalents being available in the fall. We don't know when that will be, and we don't know how much will be available. It may be that only certain higher risk groups will initially be eligible, and it may be a longer period of time until others are eligible. So these are some of the considerations. And on to the next slide, Sarah, just to really review. Um, Again, it's important that the caveats in the conversation that I've been giving so far is related to healthy 18 to 59-year-olds. It is strongly recommended for those 16 older and those with medical risks for severe COVID-19. So if we go on to the next slide, Sarah, and here I think we've got this pros cons list to getting the vaccine now versus waiting to get your fourth dose a little bit later. To summarize, I think getting the vaccine now, we're headed into a seventh wave, and we may see this be significant or it may be small. We don't know how big it will be yet. If you're somebody who's, because of your profession or your activities or travel or different things like that, if you think you're going to be at high risk of exposure, there may be more benefit to you getting it now. If you have vulnerable close contacts that you want to protect, there may be benefit to getting it now. If you're somebody who just values the protection of this vaccine and really want it, even if it is smaller, now that's also another reason. And again, there's a lot of uncertainty on when the next generation vaccine will actually be available, but if it isn't available until later in the year, that may be a reason to get it sooner. On the other side of this scale, we have favors waiting. On the other hand, we know that, like I referenced, young 18 to 59-year-olds who are healthy are at lower risk of severe disease. Um, Waiting may mean that you get better protection from a next generation vaccine later, but there's a lot of uncertainty around that. The timing again is uncertain, but if it became available readily earlier, then that may be a reason to wait. And finally, NACI has not yet recommended for healthy 18 to 59-year-olds the fourth dose. So what I want to show, and the scales are purposely balanced, is that it is not a simple, clear decision And this is really the first time in the pandemic where I'm not out and able to say clearly, I strongly recommend this. And it's not that it's unsafe, but it's that the benefits and the amount of benefits that different people get may not be as significant as we've seen before. And so as a result, it's a more nuanced conversation and decision that individuals should be thinking about as they try to make the decision whether to get this fourth dose now or to wait into the future. On to our next slide, Sarah. A few key reminders are, regardless of your decision, whether you're going to get a fourth dose now or wait until later, continuing to wear tightly fitted N95, KN95 style masks when you're in higher risk locations indoors around others is important, and spending more time outside, especially with this beautiful weather, is beneficial. And these kinds of things reduce the risk of COVID beyond the benefits that you get from vaccine. On to the next slide as well. Key is staying home when sick. We're starting to hear about more people getting sick, not just with COVID, but other colds and summer colds and things going around. Really critical is staying home when sick. And certainly we advocate for organizations and businesses to think about providing paid sick leave if they don't already, because this is important to keeping your workplace healthy and keeping people comfortable to stay home when they're sick so that they don't put others at risk through transmission. Testing is important as well, and we're pleased that the rapid antigen testing program is extended to the end of the year. And a reminder that through the checkmarket.com/rat21 link, which we can paste into the chat, but is also available through our website, you can self-report your positive or negative COVID tests to help us with surveillance. And if you're somebody who falls into a group that's eligible for treatment for COVID-19, the provincial government website can remind you if you are, or you can call in to a healthcare provider. Then seeking out treatment early is important to preventing more severe consequences. On to our next slide, Sarah. That really brings us to the end of the discussion. I really appreciate everyone from the media joining today, especially because this is such a nuanced discussion. I wanted to take the time to try my very best to explain some of the uncertainty and to help people understand this. A couple of other comments before we move on to questions. We are writing to all the healthcare providers in the community. We recognize that primary care is in a very difficult, busy position right now as our healthcare system is in crisis. And we really want to emphasize that for people who have questions, please utilize our resources. You should not be going to see a healthcare provider unless there's special circumstances that you need input on, because we know that our healthcare providers and the health system are in a difficult place and crisis right now with the significant staffing challenges they're experiencing and the burden of both the pandemic and other accrued issues. We are also providing this short video, which is available and we'll be sharing through social media. So that may be of use to folks if they're trying to make their own personal decision. And finally, just a thank you to everyone for joining today to try to help to clarify this messaging. It's not easy clarifying uncertainty, and it's quite something that here 2.5 years into the pandemic, there still remains uncertainty. But what we're doing and trying to do is to provide the best information possible to the public so that they can make decisions and continue to stay safe in the pandemic. So thanks again for joining, and look forward to questions.
Thank you so much, Dr. Piggott. So as a reminder, please put your hand up and I can call on you. You can just unmute yourself and ask your questions. And I see Paul is first, so go ahead, Paul.
Thanks so much. Hi, Dr. Pig. It's been a long time. Can't say I'm disappointed to have not seen you, and but I will. I want to ask you about the vaccines and people getting the vaccine in terms of locations. I know the Healthy Planet Arena was no longer needed, but do you anticipate? Will you be watching for a surge, and could that possibly reopen at some point down the road if there's a real demand?
We constantly evaluate demand and our capacity to offer. We're really happy about the new space that we have, and we think it's going to be quite effective for even a large number of people. And we're also working with partners, pharmacies, others who are offering vaccine to ensure adequate availability of appointments. Over the next few weeks, I would ask for the public's kindness and patience as we try to again scale up the amount of vaccine we're delivering. This is because the fourth dose announcement is coming at the same time as we are soon anticipating that under 6 year olds will be eligible with Health Canada's approval of Moderna earlier today. And so there's going to be lots of additional demand for appointments, but we're working hard to make sure that we can meet that demand and that appointments are as available as possible. And from that standpoint, space is something we're constantly evaluating. And if we foresee an issue, we will definitely explore alternative options.
And if I could, just one more thing. People I've talked to, and I'm sure other people have heard of that. You know, they're hearing word of this new wave, and the message from the government that if if you're eligible for a fourth booster, it might be something to think about. It seems like forever now ago that we had full lockdown and all those things were happening. Are you confident that regardless of what the fall brings in terms of the seventh wave and that sort of thing, that the level of protection is high enough now that we hopefully won't get back to that state that we were in at one time?
Well, I think, Paul, we're trying not to make predictions, but we're trying to plan around all possible scenarios. The reality is, we still don't know in this continued pandemic what the fall will look like, what this seventh wave, even in the next few weeks, will look like. So I think what we're trying to do is ensure that the public has the information and protections it needs in place, and that if things do change, and the context worsens or is more severe, we're prepared to respond and to support the public health response to the continued pandemic. So we're working closely with the province and with other local healthcare partners here to do planning around all possible future scenarios, and quite confident that we'll be able to meet needs and continue to protect the public's health.
And just one more thing, sorry. In past media briefings, you've been very clear on a number of things because you could be do this, don't do this, don't do this. With the ambiguity now that you've been discussing regarding the pros and cons of the fourth dose, and people have to make a decision. Is it a little bit frustrating for you that you can't be that clear? I mean, you stated the facts obviously very well, but that's what you do, right? You make recommendations to the public about what they can do and can't do. And this, I don't know if frustrated is the right word, but certainly it's a different situation for you, right?
Yeah, thanks, Paul. It's a different situation, but I wouldn't say that I'm frustrated. I think that there is often uncertainty, and in public health, but in lots of areas, it's our duty to be transparent with the public around that uncertainty. So here I am providing the best information that I can for people to make decisions. If the context of that changes, if we really see that the benefit is much greater than I was anticipating, if we see any other kinds of considerations that change that scale risk benefit balance there that we were talking about, I'll be here and communicating that more strongly. But for now, I think there genuinely is the need for people to consider their own personal circumstances and make the best decisions that they can. This is a little bit different, like you say, to other points in the pandemic, but not all that different than other things that we do in public health. We often tell people, to quit smoking or to take certain health behaviors, and people may or may not listen to that advice or do those things. That doesn't mean I bang my head against the wall. It means I continue to try to communicate the evidence as best as possible and as fairly to how confident we are in it. And the reality is, there's some uncertainty here. So, I mean, nobody likes uncertainty, but I think it's my job to be honest about that to the public.
Well, we don't want any head banging for sure. So thank you, Dr. Piggott. Thanks so much, Sarah.
Thanks, Paul.
Thank you so much, Paul. So we're moving on to Malav, or you might have mispronounced. Go ahead.
Um, yeah, so I just wanted to ask, like, well, the usual question I think might be answered, but like, I'll just ask, like, so when will this vaccines for children below age 5 will be available in Peterborough region after the announcement of Health Canada today?
We are waiting for communication from the provincial government. We have certainly been planning towards this for many weeks, months now, and hopeful that the approval would come. So certainly locally on the ground, we are ready to roll out as quickly as possible when we're given information on when the vaccine will actually be available and distributed to us and when we can start. So at this point, we're still waiting for direction on the provincial government side on that. But Peterborough Public Health is ready to roll that out. As I mentioned earlier, in the context of fourth doses starting now, the middle of summer, many people may be away or traveling, including from the community that want these vaccines. And so there's going to need to be some patience and understanding as we make as much appointment availability as possible, and as people may or may not be able to, come forward right away. But we're certainly on our part going to do everything that we can to make this available for those coming forward. And I'd urge people to do that if they have kids under the age of 6 years of age, over 6 months of age, because this is a new added protection for them that will be important.
Can we expect like by the end of July, maybe?
I would hope so. Yeah, but
Right.
I honestly don't have a date at this point. But we certainly, as soon as we know the day that we're starting, we're going to be communicating that to the public and making booking of those appointments available.
Thank you.
Thank you so much, Malav. So moving on to Bill.
Hi, Dr. Piggott. I got two questions that sort of circle around on third dose people. I know a few people that have not got the third dose because they got COVID and they think they're protected now. Is there something to that, or what would you say to these people?
So, Bill, thank you for that. And what I would say to those people is the guidance is certainly to wait. You rest your immune system for about 90 days after you've had COVID, but then come forward and get it. Vaccine is a more effective longer term protection than getting an infection. So just because you had 2 doses and an infection doesn't mean you're as well protected. In fact, you're not as well protected as if you have 3 doses. So getting infected certainly adds some protection against future infections, but it's short-lived, and the vaccine is a longer lived, especially that third dose protection. So it's important for people to come forward and get that. We know that risks still exist with repeat infection, and especially things like long COVID. The risk can be present if you didn't have an experience like that in the first time that you got infected. If you get it again, we're seeing the variants continue to shift enough that the immune system um, is vulnerable to an infection again, sometimes with a short period of only a few months between. So I'm strongly urging that people that haven't had their third dose yet, regardless of infection, though if you did have a recent infection, waiting that 90-day period, come forward and get their third dose for that added important protection.
And I guess the other question sort of follows that. If there are people there out there that have only had the 2 doses and they hear, hey, there might be a better thing coming in the fall, are you worried that people will say, I'm going to skip the third dose and wait for this better thing in the fall?
Um, Well, I think that the question on waiting in my conversation today was largely around the fourth doses. I certainly don't believe that people should be waiting for a third dose in the fall. If for no other reason, they are susceptible, significantly susceptible to COVID infection in the next few weeks, with rising risks in a seventh wave that we're anticipating here in Peterborough and across the province. So the third dose now will protect through that. Again, the province has not indicated that there would be any issues with eligibility in the fall with a next generation vaccine and bivalent. So certainly, if you're thinking about, if you're 18 to 59 and healthy, and you're thinking about waiting on a fourth dose, I understand that. But if you're thinking about waiting on a third dose, I would not wait any longer. I certainly would be coming forward and getting that vaccine now for the important protection it provides.
Perfect. Thank you very much.
Thanks, Bill. And Malav, I see you still have your hand up. Are you hoping to ask another question, or is that a legacy hand?
I think it might be that by mistake. Sorry.
No, that's okay. Thank you so much. Do we have anyone else who's hoping to ask a question today? Okay. Well, thank you all so much for your time. I hope you have a lovely rest of your Thursday, and hopefully we'll chat soon. Have a good day.
Thanks so much. Thanks, Dr. Piggott.
Thanks everyone for joining. Take care.